Right, good afternoon. This morning I was advised of a new community case of COVID-19 in Auckland. The case is not a worker at a managed isolation facility, and at this stage in the investigation there is not a clear link to a facility or to the border. We've made a commitment to be as open and transparent as possible around our COVID-19 response, and in keeping with that, we're sharing the information that we have now as soon as possible after we've found out. But I want to stress that we're in the early days of information coming through. Many of the questions that people will immediately have, we do not yet have answers to. So we will be undertaking a further press conference later on this afternoon, likely around 5 p.m. And further information will also be shared with those who need to know that information as it comes to hand. We have a plan for dealing with cases that emerge in the community, and the deployment of that plan has stamped out cases quickly before. That's what we'll be focused on. Our approach needs to be calm and methodical. I'll now ask Dr. Bloomfield to give you the details that we have so far. After that, I'll run through a few of the immediate actions we're taking now and how we want people to respond, and then we will take a few questions, although I do note that a fuller update will be provided once we have more information. Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So in total today there are 3 new cases to report. One case is a returnee detected in managed isolation, and there are 2 new community cases. One of these is connected to the November quarantine cluster. This case is a close contact of case B in that cluster and tested positive on the 11th of November after developing symptoms. That person, we are calling case C, had already been in isolation since Saturday, as had the members of their close family, and they are in quarantine at the Grand Mercure here in Wellington. I will provide some more information around the November cluster shortly. But moving now to the case that the Minister has talked about. We are reporting this community case in Auckland, for which we continue to investigate the source of transmission. The person became symptomatic on Monday the 9th of November. They were tested late on the 10th of November, and they went to work at the A to Z collection on High Street from Sunday the 8th of November to Wednesday the 11th of November. I'll come back to that shortly about our instructions or requests to people who may have been there. The positive test was just confirmed this morning, mid-morning, and the person is being moved to the Auckland quarantine facility today. This, to start with, is a very important reminder of why anyone with any symptoms of a cold or flu get tested, and our request is to stay home until you have the results of that test. Auckland Regional Public Health is interviewing that case further. They have already had an initial interview to identify close and casual contacts and to further understand all their movements, not just since they became symptomatic, but in the preceding week or so. So that is, in the first instance, to identify who may have been in contact with the person since Saturday the 7th of November, but also going back to see if we can ascertain, of course, importantly, the source of this infection. The person does live alone and appears to have had limited community outings recently. They have not visited a supermarket during the period. They might have been infectious. Whilst the person is a student at AUT, they have not been to the campus or to any lectures or classes since mid-October, so there is no concerns with any potential exposures on campus. At this time, and as a very precautionary measure, we are asking people who may have visited the A to Z collection store at 61 High Street in central Auckland, and or who is a resident at or a visitor to the Vincent Residency at 106 Vincent Street in central Auckland. The dates of interest are anyone who has visited those 2 locations, or indeed in the case of the apartments, lives at the Vincent Street residences between Saturday the 7th of November and today, the 12th of November, to seek a test and isolate until you receive the results. As usual, anyone in the Auckland region and indeed wider New Zealand who has cold or flu symptoms should get a test and not go out, but stay at home, not go to work or school or study until you have had a negative test result. There are details on where people can get tested in central Auckland or anywhere in Auckland if they have visited either of those two venues on the Auckland Regional Public Health website, and we will update during the afternoon on additional pop-up testing sites for people close to those venues that will be made available. There will be additional locations of interest, and as soon as we identify that, we will send push notifications via the app and provide wider public messaging. We are, as I said, also getting that additional testing, which should be available later today, and we will let you know the locations of that testing. We're urgently working to trace the person's movements so that we can identify not just people who may have been in contact, but where the infection may have come from, and genome testing has been urgently undertaken overnight to see if we can identify a link with our existing cases that we already know about. At this stage, we are not advising of any change to other settings, and we will be constantly reviewing those as further information comes in. Anyone with any concerns about today's news can ring Healthline's dedicated number 0800 358 5453 for advice. Amongst other usual details report, our imported case that I spoke about arrived on the 9th of November from Los Angeles. They have returned a positive test at around day 3 of their stay and are now in the Jet Park quarantine facility in Auckland. 2 previously reported cases have now recovered, and our total number of active cases is now 53, and our total number of confirmed cases to date since the start of the outbreak of the pandemic earlier in the year is 1,635. And yesterday our labs processed 6,581 tests. So just back to the November quarantine cluster, we now have the 3 people connected to that cluster. The case C, which I've just spoken about, is a civilian New Zealand Defence Force worker and a close contact of case B. They were part of a lunch outing in Wellington at the Little Penang restaurant on the terrace on Friday afternoon last week, and on developing symptoms on the Saturday they had isolated at home and had a COVID test. Although they initially returned a negative result on day 3, they were moved to quarantine as a precaution on Tuesday, and a second test yesterday returned a positive result. Should say we've asked the lab about that earlier negative test, and they're very clear that it was a negative test. So push notifications have previously been sent out for the Little Penang restaurant on the terrace, which closed for a deep clean earlier this week. It was visited by cases B and C, as I said last Friday. However, just advising anyone who did visit that restaurant last Friday to between 1 and 4 p.m. to be very aware of symptoms and isolate and have a test if they are symptomatic. The household contacts for this latest case, case C, are in isolation already. They have already been tested and returned negative results. They will be remaining in isolation for the full 14-day period and retested as part of that. All other close contacts of case B have returned a negative test result. So, of course, our thoughts are with these 3 people and our other people who have currently got COVID-19 infections, and we wish them swift recovery from those infections. And just finally, we now have 2,349,000 registered users of the COVID Tracer app. And just a reminder to everybody, you never know where and when that information will be useful. Please do continue to scan QR codes wherever you go. Thank you, Minister.
Thank you, Dr. Bloomfield. As Dr. Bloomfield has indicated, our immediate response to any community case of COVID-19 is to gather as much information as possible about the case's movements and the likely source of infection. That's the process that we're engaged with at the moment. As information comes to hand, we will share that as quickly as we're able to, and alerts will be issued through the COVID Tracer app to those people who may have been in the same place as the potential case. I want to reiterate what we've said all along. People are not the problem. People are the solution. It is the virus that is the problem. Everyone has a role to play in responding to any cases of COVID-19, and we all have a role to play in continuing to take preventative measures so that we stop any potential spread. If you live in Auckland and you have any cold and flu symptoms, please contact Healthline and organise a test as soon as possible. If you do have cold and flu symptoms, please isolate. Don't go to work and don't have contact with others. we will be setting up further community testing stations, but we need to ensure that those who need to be tested can get a test and they are at the front of the queue. So in the first instance, we need people to get tested who may have had contact with the person, or those people's contacts, or those who are showing symptoms. If you're out using public transport, please wear a mask. Please observe social distancing. If you're flying in and out of Auckland, please wear a mask. We'll provide further advice on mask wearing later once we have further information. But in the meantime, it is a simple action people can take to protect themselves and to protect others. Testing and isolating are the key to circling the virus and to stamping it out early. While we're gathering information, we need everybody to take responsibility for doing the right thing. As I said at the beginning, we're sharing this information early. We're still gathering further information and we will share that as it comes to hand. So till then, we want everybody to keep calm, follow health instructions that we've just provided and any other instructions that may come out, take simple precautions like mask wearing, scanning QR codes, and so that we can help to quickly contact trace if we need to. And of course, as always, if you're sick, please stay home. Happy to take
Why are you not changing alert levels?
Look, we don't have enough information at this point to make judgment calls on alert levels. As soon as we have that information, of course, we will share it.
But you do know that this person was infectious up to 5 days ago and you don't know where the infection came from and you're still piecing together movements and contacts. Is it not a good idea as a precaution to move alert levels in Auckland at least?
No, at this point we don't have enough information to be getting into a discussion around alert levels. We will do that before the end of the day and we will have more information on that before the end of the day, but we're just not in a position right now to share that information.
How much mask scanning or diarising had this person been doing, if any?
We don't have that information as yet. That's still being gathered. Obviously, the important thing that the public health unit gets first of all is what were their movements and who are the potential close contacts, so we can isolate them. But as that information becomes available, we will share it.
Are you surprised that someone thought to go and have a test yet didn't bother to stay home until they received a result for that?
Well, I don't want to pass judgment on that because I don't know the full circumstances.
Were they advised to stay home after the test?
Again, I don't have the information on that.
Did staff members at Little Penang get tested, and how strongly did the ministry advise all of them that were working that day to get tested?
Well, that follow-up was done by the local public health unit. I'm not sure if the staff members there were tested, but we can come back with that information. I'll just reiterate the advice I've just given again. Anyone who was there from from 1 o'clock to 4 o'clock last Friday, which was the 6th of November, to watch out for symptoms and get a test if they become symptomatic.
Something that you should be aware of, though, whether or not the staff were tested?
Well, not something I'd necessarily personally be aware of, but I can get that information and provide it.
The contact circle that you know at the moment, like the number of employees at the A to Z and the number of residents at the St Vincent's, how big is that contact circle?
Well, what I can say is that the case lives alone, so there's no immediate household contacts, and has had limited sort of movement aside from travel to work or going to work, which is, from where I can see, is in the CBD and likely to have been walking. So just interaction with colleagues at work at this point in time. No further information about other close contacts yet.
Idea of how big that contact circle is?
Not yet, but we will provide that at an update later today.
In a customer-facing role?
No, we don't have that information. The initial information I got was that it may not be a customer-facing role, but that's clearly important in terms of the likely exposure to people visiting the store, so we'll confirm that as soon as we know.
You said that you weren't sure if the person had been advised to stay at home after getting a test. Isn't that stock standard? So if you don't know the answer to that, are you suggesting that people aren't being told to stay at home until they get the result back?
Well, actually, our advice to anyone with symptoms, let's take it away from this case, our advice to anyone with symptoms in the first instance is to not go to work and not go to school or to go out and limit contact with other people. And the only people who are required to stay at home in strict isolation until they get the test result are those who meet that high index of suspicion. So they may either work at a quarantine or managed isolation facility or at the border or be a family member of those people. However, I can't comment on the individual circumstances around this person, and it doesn't change the advice at the moment, which is the advice we're giving about what people should do right now.
So you said you'll provide
advice later on mask wearing once you have more information. What sort of information would prompt a change to the current advice on mask wearing?
Look, that will include, a better understanding of the risk that we're dealing with, and with regard to this particular case. At this point, that information is coming in, that's being gathered, it's coming in quickly, but we just don't have enough information on that at this point. So that will include the consideration around alert levels, all of those, discussions that we will be having this afternoon and into the evening.
You've asked people in Auckland to socially distance.
That's right, but this is the advice that we would always give, which is socially distance where you can, where you can't, wear a mask, do all of those preventative things, cough into your elbow, wash your hands, use hand sanitizer. All of these preventative measures can play a role in helping to stop the spread of the virus.
Essentially level 2 though, why not just move Auckland to level 2 for now?
Look, we haven't made that decision, we don't have that information, and like I said to you, we will have more to say about that later, but we don't have anything further on that at the moment.
Will the decision on alert levels be taken by 5 p.m, and what's the government doing behind closed doors? Will there be an emergency meeting of the COVID committee to decide that?
Ultimately, there'll be a movement in alert levels would be preceded by a cabinet discussion, and we will know more about whether we need to have one of those in a few more hours. So at this point, like I said, information is still coming in, and we haven't got enough information to be making those calls at the moment.
So we should expect one by 5 p.m. then?
If we need to have one, then we will have one.
Do you have any more information on KC? Is it a man, woman? What's their age? What is their job title?
Well, no, I don't have the information. What I can say is they're a civilian worker at the New Zealand Defence Force. They're a known close contact who has been in isolation along with their family since Saturday and didn't develop symptoms till Monday, and had already tested negative on Sunday.
What's happening with the A to Z collective store? Has it been shut for the day? Has the ministry provided the store with any advice?
Well, the public health unit would have done that, and the standard protocol is at a minimum to shut the premises and do a deep clean. But it may well be, if the staff are close contacts and have to go into isolation, that the store has to close. We've seen this with premises before. For example, the pub in Greenhithe closed because they couldn't staff it because staff were considered close contacts. And the government has schemes in place to help with replacement income and revenue for businesses that may have to close.
So the store is closed?
That would be the advice it would have received.
What thresholds would you be looking for, and what sort of decision-making criteria do you have around this later update today regarding the decision whether or not to change alert levels?
Look, I would refer everybody back to the resurgence planning that we have published, which talks about the types of things that the Cabinet would take into consideration in any review of alert levels as a result of a case. That sets out, all of the relevant factors. At this point, we just don't have the information to weigh that information against those criteria. So it will include, what do we know about the likely source of infection, what kind of movements the person has had over the infectious period, which we're getting more information on. All of those things will come into play.
You won't have this information by this afternoon, and that you will still be sort of blind. What will you do if you don't have this information?
Well, absence of information is also one of the things that we take into account when we're making those sorts of decisions.
Last time we had a case like this, with no source apparent, then within hours, Auckland moved to level 3, and the rest of the country to level 2. What is different about?
I don't.
And are you simply hoping that a source will reveal itself?
We weren't sharing the information quite as quickly as we are now. I mean, literally, I've had this for about an hour and a half, just under 2 hours at this point. Whereas previously, you recall, it came in just after the 1 o'clock, the regular update cycle, and we had a bit more time. And the update was late in the evening. You may recall. So in this particular case, we're sticking with the timetable we had, which was to do an update at 1 o'clock. I appreciate that there are still a number of questions. And I'm hoping to be in a position to be able to answer more of those as the day goes on.
And says to move, it suggests to move to level 3 if we do have a case with no source. So are you hoping that it won't be necessary and a source to the border or an MIQ worker might go identified by 5?
Look, we can hope for many things. What we have to work on is what information we have to hand at the time that we make those decisions. We will be having those conversations this afternoon to look at what the most appropriate response with the information that we have at that time is. And at the moment, as I've said, we're still gathering further information.
Explain what's happening between now and 5 p.m. Are health officials speaking to the infected person, and what's happening from a government official perspective on alert levels and when decisions will be made?
I'll ask you to comment on the case investigation, then I can deal with it.
Sure. So there'll be further discussions with the person that the Public Health Unit will be doing to really go back and interrogate exactly the possibilities of where the person may have been infected, including any potential interaction with people who may work at the border or at our managed isolation facilities, or who may have travelled from overseas for some reason. So that's the first thing, and then that will inform the public health response, including any other premises or places that we may notify people to, if they've been there, to isolate and get a test. And then, of course, that is part of the information that we can then provide to the Minister and Cabinet that would help inform a decision about whether an alert level change is necessary or whether other public health measures could be implemented as an interim step.
What's your message to Aucklanders who may be starting to panic about the situation?
Look, panic never helps with COVID-19. We're still in the very early stages of this case investigation. We're sharing this information, being transparent about it, because we know from past experience that when you start telling people, in smaller groups, that information tends to come out anyway. So we want people to know that we are aware of it, that we're investigating it, and that we will be transparent. We will share more information as it comes to hand. Just to answer the second part of your question around what happens in this building for the rest of the day, obviously we'll be looking at scenarios. So we'll be looking at, depending on what that information tells us later in the afternoon, what types of actions might we need to take? Would we need a cabinet meeting, which would most likely be a virtual cabinet meeting? If so, have we made sure people are available for those types of discussions? So that would happen this afternoon. That's the sort of the preparation that we will do this afternoon. But it will again, which action we take will depend on what more information we have. Now, look, I'm aware that, as I've said, that there are a lot of questions that we don't have answers to at the moment, but relating to this particular case and to alert levels. So we will deal with those at the next update, which will be later this afternoon or in the early evening. If you've got questions on other aspects of this that you wish to bring forward, please do that now.
Whether the student has been moved to, or there's consideration of moving them to Jet Park?
They have been moved to quarantine, yes.
When did the Ministry of Health receive this information? At what time? Because the Ministry of Health said this morning at 9:30 that they won't be holding a 1 p.m. presser.
Yes, so the initial notification came in just before 9 o'clock. It was an early notification into our EpiServe system. At that point, that was the same point that Auckland Regional Public Health also received the notification from the lab. So that was when we then met with Auckland Regional Public Health, and they at that time were in the process of contacting and interviewing the case. And it wasn't until around 11 that we had enough information to then have a conversation and consider whether or not we would do a stand-up today, and that's certainly what we've done, as the Minister said.
How many people have QR codes signed into A to Z collections?
We don't have that information yet, but we will. When we push the notifications out, we will let you know how many people those notifications have gone to.
Will you be doing genome sequencing, and if so, what's the sort of time frame of getting some information about that?
Yes, so the sample's on its way now to ESR here in Wellington. They're going to process that overnight, so it will be tomorrow in the afternoon. We'll have the genome sequencing, and that will be critical in terms of our ability to link it to one of our known cases already, recent or perhaps not so recent. I just want to make one comment following up from what the Minister said in terms of what's a key message to Aucklanders. The thing that has worked in New Zealand and globally when you get this sort of situation is to act in the best interests of other people, and that's exactly what the Minister's reiterated. So don't go to work if you're symptomatic, get a test, wear a mask, observe physical distancing. That is exactly how we have done well to date, and what matters is what we do now and what we do next, and that is to continue to act collectively.
What proportion of cases do we have sequenced currently?
It's increasing all the time. Every sample where we have got enough of the RNA material to be sequenced has now been looked at. So we'll come back actually with an update on what proportion, but we have a large number of our genomes now, a large proportion of the genomes now sequenced.
Okay, I'll draw it to a close there. There will be a further update later on in the day. Thank you.